So we're going to start. Hello, everyone, and welcome to the third seminar in our Research in Action series at Trinity College Dublin. I'm Luciana Lolich. I'm the Research Impact Officer at the School of Nursing and Midwifery. This series explores how academic research can drive meaningful change in public policy. Today, we are delighted to be joined by Professor Catherine Comiskey, a leading authority in healthcare statistics and public policy. Her work spans substance use, child well-being, and innovation. And she has advised the EU, the UN, and the Irish government on national and international drug strategies. Professor Comiskey will be sharing her insights on how research can be effectively translated into policy and practice. We'll take questions and answers at the end of the session. Professor Comiskey, thank you for being with us, and over to you.
Oh, thank you very much, Luciana. You're very welcome. Welcome, everybody. I see we have over 40 people in the room, so thank you for taking the time to join us today, and I hope it's useful and that you'll take away, even if you take away one thing that improves your work, I think it will be a worthwhile hour. So thank you all. I really appreciate your time. So today I've labeled my talk or titled my talk, Win-Win, using research to enhance the policy to practice reciprocal process. And I think it's very much this idea of reciprocity, where we're doing good research that people want done. And I think that's one of my key learnings. I've been thinking about this talk, and I will be talking about different projects, but I've been thinking not so much about the projects, but what did I learn over the years in terms of that got me to this point of impact. And one of the key learnings that I always say is do good research. It's as simple as that. Do good research, and do good research that people want to know the answers to. So address questions that people want answered, and then do it. And if you can't do it all, just do a small foundational piece and do it well. So it's about win-win. You do good research, they get part of the answer. So I'm going to illustrate that, if you like, through different projects that I've worked on. And I was thinking about it. It's not just about the outputs, whether it's a journal article. You know, many of you may be doing your PhD and focusing on your first, second to third journal articles, but there are other ways of outputting or getting outputs from your work. And you should always be looking for opportunities to develop outputs from your work. And as we go through the examples, I'm going to be talking about maybe a blog. When might a blog be useful? When will you be ready to write a book or contribute a chapter to a book? You've got your standard journal articles. What about MOOCs? Do you know what they are? Massive open online courses. I'm going to talk about that. Also, within our school, we're very fortunate to have people like Luciana and Jenny and Elizabeth, who are on the call today, who support research, help us with our impact. And we have communications people as well. Maybe there is something you can write for a newspaper. Not every output, you know, is for every audience. So you have to look at the breadth of your audiences and see what is the appropriate output for that audience. And it could be a newspaper article supported by the good research underlying it. It could also be maybe a video, audio, images, or even artifacts if you're working in the arts. So these are all outputs speaking to different audience. But you have your output, but how do you turn that into an outcome? How do you turn that into something that's useful for a practitioner or a policymaker or a government committee or the EU or people who use services? And I'm going to talk about that as well, because they are where you bring your output to the appropriate audience and you achieve an outcome. You achieve change in practice, or even if it's only to get people thinking about their practice, or you stimulate a policymaker to ask a ministerial question, or you get invited to a meeting in a European conference or something, and you're making, you're stimulating thought at an EU level and so on. So we're going to look at just our outputs. Where can we maximize our outputs and then turn those into outcomes? And we're going to illustrate that through 3 projects. So the 3 projects I've chosen, there are many I could have chosen. I've been in my career a long time. These are the 3 I've chosen. One is my work with South Africa, and it's currently centered with the Stellenbosch University in South Africa and the African Doctoral Academy. I'm going to talk about that example. So that's an educational example, if you like. Then I'm going to talk about a nursing model that I developed. And if you like, that's an output and an outcome that changed nursing practice. So we've got an educational, we've got a nursing practice, and then a research and policy, the prevalence of neurodiversity amongst people who use drugs. That's something that I'm currently working on, and I'm going to look at how that has actually impacted upon policy. So I'm going to go 3 little stories for you. Tell the story through those particular projects. So this is just some images from my work with Stellenbosch, but let me tell you the little story about the background. So I live in the Dublin Mountains, way up in the Dublin Mountains. There's a bus that comes up a very bad mountain road twice a day. It goes down twice a day and it comes up twice a day. And before COVID, everybody, you didn't work at home. So when it would snow, we would get snowed in up the mountain. But this email came through, and it was actually from DCU. And it was looking for people to possibly get involved with Irish aid and development of PhDs. And it came through DCU. But one of the names that I saw on the list, apart from my name, I don't know where they got my name, but my name was on that. I did do my PhD in DCU. Maybe that's why, I don't know, or maybe it's other work I had done. But I saw, and I was only a lecturer at this time, an assistant professor. So I saw a name on that list who was a chair within Trinity, and she was in computer science. And I thought, well, if they're sending it to her, it's, if it's good enough for this chair in computer science, it's good enough for Catherine. So the day of the meeting, it was actually snowing. I put on the Wellingtons and I made my way down the mountain and I went to DCU, and very few people turned up. And we met the 2 ladies, one who was called Charmaine Williamson and another lady called Anne Shue. Anne Shue was the boss, and Charmaine was giving a talk. And they said, look, we're looking for academics to contribute to PhD development programs in South Africa. And these are the topics, developing the research question and so forth. And I said, I'd be interested. And they said, if you want to put your name down. So I put my name down and I thought, oh yeah, I do statistics and maths and, research, they're going to contact me. They didn't contact me. Took a couple of months, but eventually they did contact me, and I was invited. The very first meeting I went to, actually, the very first event they invited me was actually in Ethiopia, and it was with 100 PhD candidates, 99 men and 1 woman in the room, and there was a team of us invited to develop and deliver PhD content. People were preparing for their PhDs. That is at least 12 years ago, if not longer. Then I was invited to South Africa, and they were working on nursing PhDs and other PhDs. And I went maybe once a year, and I worked on helping people with their PhDs. Then COVID happened. So as you can see here, I did some videos. I was very conscious that when people came to do their PhDs, once they left the doctoral academy, they didn't have access to the same computer systems because the people came from all over Africa. So that's when I decided I would actually do a blog, and that I'd put all my lecture notes on the blog. So immediately I was able to share all my lectures. So once their sort of time had ended on the course they were on, they still had access to all of my materials. So I shared everything. I created the blog. I invited people to share their comments on the blog. And it turned out that the blog actually also gave me an opportunity to have non-academic outputs as well. And then I realized that they were doing a lot of evaluations. And again, it's looking for opportunities within the work you're doing. I always say to my team, and I have a very large team, it's not about doing more work. I know you're all working hard. It's about doing more with what you're already doing. So if you're already doing the work, can you do more with it? So I said, you've got all these evaluations. what are you doing with them? You know, you're reporting on numbers. Can we do more with them? So we actually did some papers, which I'll show you in a moment, and we ended up informing strategic plan. I never knew when I walked down the road to get the bus, you know, down my own lane on the Wellingtons to go to DCU, that I would end up informing a strategic plan for PhD development in South Africa. Little did I know, but I just know you have to put yourself out there and say yes. Thinking I said yes to this seminar today, didn't I? You know, and I mean I've got a lot on, but I said yes to the African Doctoral Academy. You got say yes to the dress, as they say. We presented a report, and Anne Matthews was in DCU, and we wrote this together. And these were three of the top professors in nursing in South Africa. Judith Bruce has now, she was in Wits, she moved to another university and she got a chair there. Hester Klopper is president or vice chancellor of University of the Free State now. And Mavis Maludisi is in Pretoria informing policy and working at the university there. But when I was working with them, they weren't at that level. But my name and my work is now in their name and in their work at that level. I didn't know that at the time, that this is where that was going to end up. So this is some of the work that we've done. This is 2 papers that we've written with the South Africans on evaluating the work and where were the gaps. One, as you can see, he was looking at global shortage of nursing education. So I was able to address all that global shortage. And I've learned so much from looking at that literature and then using the data they had and using some implementation science to actually do more with what they were already doing. And you'll also see the different names on some of these papers and reports. I have no problem adding in lots of names of people of giving me data and sharing. I share everything. And as a result, people share with me and we all win, win, win. I'm continuing that work. I subsequently got invited to be a visiting professor at Wits with Judy and work with her team there as well. And then I got invited back to Stellenbosch. And last month just, I was invited to meet when the South Africans were over on a visit with our president and with our Minister of Education. I was invited to meet the Minister of Education who was visiting Trinity. And there was about 10, 15 of us only invited from across Trinity. And then one of my South African colleagues said, oh, Trinity has actually been mentioned in the press release that they did when they went back to South Africa. And I was able to, you know, bring my word to the table to directly meet the actual minister. And when we were getting the photograph taken, I'm the one who suggested we get a photograph taken. I went up and I spoke directly one-on-one with the minister. And that's the sort of thing you have to do. I mean, polite, of course, and, you know, respectful, but you have to, you know, you have to talk about the research that you're doing and share it with people and say, you know, would this be of interest to you? And what are you doing? And hear from them. Because I did all of that work over the last 12 years, whatever, I'm currently writing a book which will be out in the early new year with another colleague, Liz Curtis, on capacity development. And I've invited all of my international collaborators to collaborate on that book so that they will use the book. And I'm writing a book at the moment, or editing a book, and several actually contributing to many of the chapters within it on capacity development in PhD tertiary education. So one thing leads to another. And Springer Nature have taken up that book, and they are like international, one of the biggest publishers. They're in New York, they're in Switzerland, they're all over the world. And they also published my previous book, which was specifically on my topic of addiction. And who did I invite to launch that book? It was the Minister for Drugs at the time, Colin Burke. Okay. And I'm already planning who are we going to invite to launch the new book on capacity development. And I'm going to ask the South Africans if they'll launch it in South Africa as well, and so forth. Again, making that sort of impact. So moving from the output to the outcome. And that's in education. But it was doing research on the data they were already collecting. Just keeping an eye on the time here. Okay. Um, this now is on another example then in nursing, a nursing model. I don't know if many of you may not know, I'm not actually trained, I'm not a nurse. My background, believe it or not, was in mathematics and philosophy. So I always say I can read, I can write, and I can do arithmetic, the three famous R's. But been so fortunate to be a professor in the School of Nursing and Midwifery, and everybody who works with me knows I love our school, and I've learned so much from being in that school from my colleagues. So again, a group of nurses out in Ballymun, in Ballymun, who were working in practice, set out a small tender to do a piece of work to help develop a nursing model in addiction. And I thought, well, I don't know much about nursing models, but I absolutely know about addiction. And I tendered for it. And I had to go out and sort of talk to the nurses in practice out there. And they had had their practice reviewed through the National Drug Strategy. And they said their practice was very reactive and they wanted to inform their practice. And they had about 2,000 clients. So we set about doing a piece of work. And I said, look, I'll help you do some funding applications and let's see if we can address this gap. So we addressed this research to practice gap, and I particularly like this little comedy sketch here, and I have permission to use it because I emailed the authors some years ago. The miracle has to occur, and I particularly like this because it is in mathematics, because that's how I used to feel in mathematics that a miracle would occur. How do you get from A to B? And you just try. You just keep trying, and you just go from step to step. So I spoke with the nurses and tendered for the piece of work. And I said, look, I will help you apply for the funding, but it'll be in your name. So I did. I wrote the funding application. It wasn't even in my name, but it was collaborating with me, and the money was to go to them. And it was from the Nursing and Midwifery Program Development Unit. And we got the first sort of €25,000 to develop this nursing model. So this is some of the people that I worked with on this educational and research project that we did. Worked with a range of nurses. One was working in James's Hospital. That was Jean. Dave McDonough had done his PhD on trauma and adverse childhood experiences. Sonam had done work in innovation. Jean there was working with people who sometimes came out of prison. And then we also brought into our research the European Monitoring Centre for Drugs and Drugs Addiction. I had been involved with them and I asked them, can you provide us with some source materials, which they did. The Anna Liffey Drug Project worked at Outreach. So Miss Dawn Russell, she's now the CEO, but she wasn't then. I said, would you like to be involved? Bring your expertise to this. We worked with a midwife from the Coombe Women's Hospital. We worked with somebody in Kenya because we were developing something that would be suitable for international nursing as well as Irish nursing. This gentleman, he worked actually in emergency medical response unit. So he drove an ambulance, but I had been on Twitter and he had followed me, and were in correspondence at that time through Twitter and now X, which I'm unfortunately not on anymore because we don't agree with the same principles, let's say. But I said to him, would you like to be involved? I thought, wouldn't it be fabulous if we had somebody from Kenya? Because then they'll promote the work as well. He was delighted to be involved. And then Julie worked with TB and HIV care in Cape Town. And I didn't meet her through the African Doctoral Academy. I met Julie in Portugal at a conference, and I sat with her, and she was a complete stranger, and we turned out we got on really well. I heard all about her research, she heard all about mine, and we've been working together ever since. Again, it's just talking about the research. And she invited me to be on a fabulous piece of work she's done on women who have been raped and who use substances and who have been abused in South Africa. She's done an amazing piece of work, and I was on her advisory panel. But I had asked her to be on my advisory panel for this piece we're developing. And then Malukan, now Dr. Malukan Bassa, he's from Ethiopia, and he had been a master's student and then a PhD student in our school, and he has links back to Ethiopia. So all of a sudden, by involving more people, we have such an international reach for our work. And this had started out with nurses in Ballymun. working in practice. So what did we do? They discovered, look, their work is way too reactive. We've 2,000 clients. I think they had a team of 9 nurses. We cannot, provide a good service. It's a very reactive service. And so we did a measurement of client need with the first 25,000. We saw great need amongst clients. The nurses working with the nurses, they looked over nursing models. I looked at the literature review on nursing models. And then we actually, with their work and my work, we developed a nursing model. We then said, look, here is an example of the clients that the nurses are dealing with. This is a young man called John that I've worked with on some of these studies. This gives you an example of the challenges that he's had to face during his addiction and his family background and his adverse childhood experiences. And remember, on our team, we had Dave, who had done work on adverse childhood experiences. He was expecting his second child when I met him, which was wonderful. He was in recovery. He was living outside of Dublin. And when I interviewed him, I tell this story because it was just so powerful when I met John, was he bent down to roll up the trouser leg to show me where he had been shot when he was 17. And I was thinking, what's coming next? But he was now in recovery. But this was sort of complex cases that the nurses maybe were dealing with. Um, and we had a very powerful research where we looked at the needs of the clients, we looked at nursing models, and the summary of that work said, look, we need to develop a nursing model that addresses mental health and psychological supports, as well as the general nursing needs. These are not mental health nurses that I was working with, but there was definitely, you could see that within the nursing practice and working within their scope of practice, they were providing an awful lot of additional support, not taking the place of the mental health nurse, not taking the place of the counsellor in the service or the psychiatrist. But there was a lot of support needed. So we developed from all of the information we had that we have to look at client needs. The model has to be adaptable. It has to be nurse led. It has to be measurable. How do we know we're doing a good job? And can we actually implement this model? We have to be cognizant of the person and the environment, because somebody working in Ethiopia or working in Mayo or working in Ballymun or working in Spain, they're working in different policy environments, different resource environments, and so forth. But it also has to be cognizant of the fact that nurses, even general nurses, are working in a biopsychosocial approach. So we said we need to look at perhaps a brief intervention approach and target a single measurable behavior change. Don't try and do too much. It won't work. Do one thing and do it well. So we developed a model, and then we went back to the NMPDU and we said, look, we've done all this. We've got a model. Can you give us the money to evaluate the model? And they said, yes. We evaluated it. We found where it wasn't working. We simplified it. We changed it. And then we went back for the fourth time to the NMPDU and we said, we've done all this work. You invested all of this money. We want to develop what we call a MOOC to share this learning internationally, a massive open online course. And lo and behold, NMPDU said yes. So what started off with a tender and me going out to Ballymun to talk to nurses about a nursing model, it started off maybe we'll get 25,000, turned out to be 100,000. We didn't know that, but we just did good work. We worked with the nurses in practice, worked with the services, the other services as well. And then we said, let's develop this MOOC. And a MOOC is a massive, open, in other words, free online course. And Trinity works with Future Learn to host those courses. It's free. It's open to a large scale number of people. It's generally at an undergraduate level. It's also targeted towards general public, and it's delivered by universities in collaboration, in our case, with practitioners and service providers. And then the MOOC provider is Future Learn. They host them. And we developed the MOOC again with the nurses. So we did videos. We had short articles. We had assessment and implementation. They're the different sort of tools. So we would have had an interview with the midwife. We would have had, we had actors come in and do a scenario of how to do, as a nurse, a brief assessment. And we completed that MOOC during COVID, believe it or not. It was absolutely crazy. And the MOOC is still going strong today. And we have had, what I think, as of recently, nearly 4,500 people all across the globe use that MOOC. Now, if that isn't impact, what is? And that all came from working with the nurses in Dublin 9 out in Ballymun who work in the addiction centres, and huge impact. The nurses took the healthy addiction treatment recovery model. They presented it to the HSE. The HSE adopted it as their practice, and then other areas have then gone. I think it might be Bray, I'm not sure, have gone then to Ballymun and said, well, tell us about your model. And it's actually also being spread out slowly. And we did have COVID and whatnot, but the HSE accepted. We spoke to the counsellors, said we're not treading on your toes, and they said actually no. If you do those brief interventions, then we'll actually get the clients that are more appropriate to us. And then the counsellors were saying, and then when we do our work, the psychiatrists actually get to get the clients that are more appropriate for them. So it actually streamlined, if you like, made the work more appropriate. So by the nurses in the general practice doing the brief intervention during their general practice, targeting on mental health supports, because that's what their clients in Dublin 9 needed, then they're actually improving the practice for the whole team in the area. And that, as I say, has spread across the world and also across the HSE. So that's another typical, not typical, another example of starting small, doing good work, going back, looking for money, and making more and more impact from your outcome. And the final piece I'm going to talk about then is Citywide. I love Citywide. They're a great organisation. Citywide are an advocacy organisation. And I just, they're an advocacy organisation for the community and the voluntary sector within addiction services. And this is a study we did for Citywide. But again, this didn't just happen. I would have met Citywide, over the years at different conferences and that, and always admired their work. And we would have spoken and talked, because a lot of it is about reaching out and talking to people. When you go to a conference at lunchtime, do you sit with your friend, or do you make an effort to sit with other people and hear about their work, their needs? My team laugh at me because, like, I'll sit with people and I say, and what are you doing? That's so interesting. Oh, you're doing something on cancer. Oh, I don't do cancer, but have you thought about MOOCs? Oh, I don't do cancer, but have you thought about, like, what data are you collecting? You're doing that data. I had a conversation last week with one of my colleagues who's working at an international level. I said, you've all that data. I said, why don't you write up all that data and do talk about your model of working and on all that data? She says, oh, you're so busy doing your job, but don't always think about the output. And that I said you could share that model with other people of your work that you're doing, and that would be 1 or 2 papers. So Citywide, I know them just through going to conferences and meetings and talking to them. So they came to me a number of years ago and they were doing a piece on stigma. And they said, look, so and so, they'd given the money to somebody else. And I said, look, I'll help you because I admire your work so much. And I actually helped them for free. All right. Because I thought this is an investment. I admire the work of this organization. Somebody else is doing the work. He was working on his own. He didn't have that support. I said, I'll get you, I'll work with him and I'll help him. And I helped him because it was a good thing to do. Then they came back and they said, oh, we want to actually do more on stigma. And who did they come to? They came to Catherine. And now then they came and we were sitting at a meeting again and was talking to them and they were saying, we're interested in doing something on neurodiversity. I said, oh, one of my students did something on neurodiversity. So who did they come to? They came to Catherine. And this is what, and her team, because this is not me, this is the whole team, as you can see here, lots and lots. So I said, yes, we'll be able to help you with that. So again, I think this was around 20 something thousand, not big money. Okay? We've got big monies as well, but this is not about big monies. Okay, can be small monies. This started off, I think the first piece they gave us might have been 5,000 actually. Anyway, So this is a piece we're doing for them on neurodiversity, this prevalence of neurodiversity and people who use substances. And again, bringing in the whole team, Dave, who's done the work on adverse childhood experiences, Sonam, who's very much on innovation, Sadie, is PhD candidate of mine who had been doing work on um, rural addiction services. Jessica, who you may know from our school, is just the best librarian ever. And, Jessica's on all of my publications. If we're doing systematic reviews, Jessica's always there. You know, Jessica is just brilliant. Philip, who's also in our school, fabulous mental health nurse, and myself. So I was saying prior to this, okay, being asked to do this project, I actually done this project for them on the stigma. And I remember I had worked for free initially. And because Citywide represent all the community and voluntary organisations, they did a report. They sent the report into the government. Whose name is on the report? Catherine's name and her team are on the report. So again, because I was getting known and I'm known in the addiction services now and in policy, minister launched my last book. The previous minister launched the book before that. I was also invited into the Citizens Assembly. So I was fortunate to actually present at the Citizens Assembly. So the hundreds of people at the Citizens Assembly and all of the policymakers, they were at the Citizens Assembly. Okay, so this goes to show you how one thing builds on another. And this particular piece of work for Citywide built on me giving my time for free. This new piece on the neurodiversity was to do an international literature review, look at the prevalence, and look at service users' needs, and uh, provide something for policymakers and practitioners, and then report. So we did that, and we found that we got our results. Huge looking at the prevalence, okay, because Trinity, remember, has all these wonderful resources. We have the access to the library, we can do systematic reviews and meta-analysis, and I was able to bring together, you know, over 56,000 individuals from the literature and do a meta-analysis of the prevalence of people who use substances and have ADHD. And that's just some further examples. We then made some recommendations that in terms of gender and sexuality, that's really important in terms of bringing that lens if you're looking at to ADHD awareness. Services need to be modified. All right, so this is a recommendation for services. And note how this is done. This is not the technical report, right? This is the policy brief. Look how the Sonomo's great on this, doing this on Canva, modifying services, expanding existing training. So that means who's going to provide the training? Oh, maybe Catherine. That's really important, but training is needed. Looking at integrated care pathways and so forth. And finally, disseminating the evidence and the international consensus documents, because there are consensus documents on this, and Philip, our mental health nurse, was brilliant on this aspect, and ensuring a human rights-based approach, that people who use drugs have ADHD or autism have a right to a service and shouldn't be denied services because of maybe challenging behaviours. But this does happen because of a lack of training and awareness within services and knowledge. And if people are trying to provide, in the community and voluntary sector, services to people who use substances, they're not necessarily going to have training in challenging behaviours. Are the needs of people who use substances and have ADHD or autism. So definitely, more is needed. So what happened about that? So what happened with that piece of research then is that we did this policy brief. Citywide have sent that policy brief to the policymakers. Again, the Comiskey team's name is on that. And what has happened as a result of that is that I got a letter, when was it? 29th of October, it was on that email, inviting me into the Joint Oireachtas Committee on drug use. So there is a Joint Oireachtas Committee. It has TDs and senators from all of the parties, because it's called the Joint Oireachtas Committee. So myself and Philip are going in December to talk to the Joint Oireachtas Committee. And the Joint Oireachtas Committee are responsible for, informing the development of substance use policy. And there's a new strategy due in 2026. So I will be in there for 2 hours. You have to be able to answer. You see, it's all televised. And actually, this is my claim to fame, is I was actually invited to the Joint Oireachtas Committee previously about decriminalisation, because I've done some work on that. And my daughters and people tell me I'm on Reddit, because seemingly what I said was being discussed on Reddit. Because I only provide the research, and when people try and sort of get emotive, I go back to the research. So they were laughing at my reaction seemingly on Reddit because I was going back to the research. So you can look that up if you're interested. But this is how, look, I'm even having, look, it's, if you impact on Reddit, you're even impacting at a wider audience as well, aren't you? But this came from the Joint Oireachtas Committee, and we'll be going into Joint Oireachtas Committee. But just go back to the seed. This came from my giving my services free to Citywide, because they knew me. They asked me, could I advise somebody? I said yes. The reason they know me is because I speak to them, I admire their work, I meet them at conferences and so forth. So, it's all about that, meeting people where they're at. It's that win-win, all right, about doing good research. I think the next biggest challenge is going to be equity and access to research and services and whatnot through AI. Again, I'm in the later stage of my career, but I've just completed a course, and it was tough to doing it in the evenings on generative AI, because I thought I need to know about this so that I can bring that to my research and my teaching and my impact. Keeping up to date is really important as well. I've always tried in my own small way. I'm not an innovator, but I do small innovations. Like when I went to South Africa, I actually videoed my students talking about their research. So if I was talking about mixed methods in the African Doctoral Academy, I had one of my students giving an example and talking about their research on mixed methods. And they were like very amateur videos. And I did the introduction in different places around Trinity. So the Long Library or the 1937 Reading Room or our building in Delere Street, beautiful buildings. And it just enlivened it. When I used to teach statistics years ago, I used to record them and upload it at that stage. When I was teaching statistics, it was on Moodle, and I'd upload the audio file. I bought that in Argus. So you don't have to be majorly, but if you can keep ahead and do some innovation, it is good. And then talk to people, do good research, and don't try and do too much. Start small, get your reputation for doing good work and being open and accessible to services and to policymakers. So I think that's more or less me. There is my blog. It's a bit out of date, but all my lecture notes are up there. And when I feel something deeply, I tend to write it. So I don't write that often on the blog. And just go back to that slide. I have 2 books. Third book is due out in the new year. And there is the MOOC. You're all welcome to do that MOOC for free. And actually, Citywide have come back to me, and they have found an extra 30,000 we're going to do a MOOC on the neurodiversity as well. So that's another output. Again, I said, oh, we've done a MOOC before. Would that be something that you could maybe, use for your training? I said it would be sustainable. So building on my learning from other examples and other work, I bring that forward to help other groups. So that's me. Do good research. Keep it tight. Keep it small if it's just you on your own, and talk to people and offer to help. Thank you. Thank you, Luciana. I think that's me.
Thank you so much, Catherine. That was a great presentation. I'm going to give some time for people. There's a lot of people saying thank you, and they found the talk really, really interesting and relevant. So while I wait for people to type their questions, I thought there was a lot of very good learning from what you were talking and what you were saying. So obviously good research is essential, and that's kind of the starting point, isn't it? But then as well, it's not enough. You have to bring it out there, connect to people, network. Do you think, is there hope for any introverted researchers or shy? They have to really make an effort.
Oh, isn't it? Oh, that's a good question. You have to speak about your research and you start small. If it's only talk to other PhD students. When I was a PhD student in maths, biomathematics, I mean, try talking to other math students. You don't understand what they're talking about, but we were made talk. You know, we. My professor would say, "Oh, this is my colleague, Catherine. Tell him about your PhD." I go, "Oh, my PhD is blah blah blah." You know, right at the start, we were got practice for talking. You know,
Mm.
informally. Um, so start. You just, you know, if people are introverted, talk to other PhD students. Go to the PhD Research Education Day. You know, I mean, when they
Start
start
small.
their first, yes, talk to the other PhDs there. Get comfortable talking about your work and asking people about theirs. I'll give you another example. I was at a talk years ago. It was children's conference, and there was a nurse there talking about visual content analysis, and I'd never heard this. And she was going through a book, and it was about children's nursing books. She was saying are full of happy, well children. You know, she said that's not the reality. And I remember thinking, gosh, I've got hundreds of children's drawings that we did in one of our studies, and I never thought of it as a data source. But because I was at this conference and I was listening to what she was doing, and then I spoke to her afterwards, I said to her, I have these children's drawings. And she said, that's a data source. But again, you know, it's like I'm not a children's nurse, but I was in her talk and I learned from her. And I was able to bring that back to make my work better. Do you know? And then there was an American student came and she put these into a report and she got her name in a report and my name was on that report. That would never have happened if I hadn't been speaking to that children's nurse and then said yes to this American student, you can work with me.
Thank you, Catherine. So there's a few questions now that have come in. Um, One of the questions says, given the influence of commercial determinants on information ecosystems, how can researchers ensure that their alternative outputs, like blogs or media pieces, resist commercialization or co-option by private interests while still
Yeah.
achieving reach and impact?
Yes, I mean, I'm in the, you know, drug and alcohol industry. You have to be really careful. Um, I'm doing a project for the HSE and we wanted to reference an article that had been funded by the alcohol industry. And they said no. You know, they said you have to be so careful. So we didn't even reference an article funded by the alcohol industry. So you have to be really careful. And I know even in our own school, we face that at a much bigger level. You know, philanthropy coming from industry that does not meet our same value system. Um, so to me, it all goes back to the value system. I work with people who share the value
Mm.
system. I mean, how do you, I mean, if people take your work, you have very little control over that if you're sharing your work. Uh, but I mean, when I'm citing my work, I go back to the source or, you know, my blog. But I suppose there is nothing to stop somebody taking something from my blog and
Mm.
using it in a way that I would not be happy with. But I suppose that's up to us as researchers to be vigilant,
Mm.
you know, with our work. And as I say, that's just an example, even in my own recent work, citing a paper and the funders, the HSE said, "Oh no, that study was funded by the alcohol industry. Don't cite that paper." So yeah,
Mm.
I'm still learning to be vigilant. I'll give you another example. I only talked about this morning. My husband went to visit the Guinness storehouse and brought me home a lovely zip up, you know, winter zip up. I said, Peter, I can't go around wearing alcohol advertising. You know,
Mm.
you don't think about these things, but we have to be more aware. If we're going to be taken seriously as independent researchers, we have to be independent researchers. I said, I can't wear that. Thank you, but I can't wear it.
Thank you. Uh, Another question, I was thinking about this when you were saying about putting yourself out there. I said, thank you, Catherine. Given the huge variety of work and success that you have you had any challenges in managing your workload?
Oh, yes. Oh, I was challenged this morning. um, yes, but I mean, it was funny. I was at a meeting yesterday. I only worry about one thing at a time. Okay. And I said to the team yesterday, because we're in a meeting and I actually have a huge project of €1 million. But you know what? The smaller projects sometimes are more work because they're shorter deadlines.
Mm.
And I said, actually, let's not worry about that. We've got to worry about this. So I worry about one thing at a time and I address it. I don't let the worry sit in my mind. Also, I don't wait for things to be perfect. I keep them moving. And in my team, I keep things moving. So like if you've done your literature review, get it published, get it out there. I would need, if we're talking to PhD candidates, all doing a literature review, I would get the publication done before I would do the chapter. Because you'll
Mm,
definitely get the chapter done, but you may not get your paper done. Do your paper first. So
mm,
it's about prioritizing. I also block out time. Really important to block out time. So like for this new book, I have 6 chapters to read tomorrow. I've been trying to get to them all week, but I've blocked out tomorrow. And
mm,
somebody said to me, "Oh, we meet tomorrow." And I was nearly going to say yes. And then I said, "No, let's meet on Monday."
mhm.
This is my time tomorrow to read those chapters. So it's about protecting your own time, and that's okay. Block it out and don't give your time away because it will be taken. So you have to be a little bit selfish. Keep it
Yes.
moving and don't be worrying about everything. Just worry about the next step. And you're not supposed to know the answer. I didn't know where I was going. I had never done a nursing model before. I had no idea. But I thought I'll learn. I'll worry about getting the money. Then I'll worry about that. Okay.
Thank you. Another question, maybe more specific. It says, I have a problem in the neurodiversity project.
Saw that
Have you
comment
even
coming.
considered about ASD?
Absolutely. I saw that comment coming in there. Would you believe our literature review was on ADHD and ASD? There was no literature on ASD. We found one paper with the prevalence amongst people who use substances. So, absolutely, you're spot on, whoever said that. We need more literature on ASD. Now, our literature was particularly people who use substances. The MOOC is addressing that we're going to be developing to spread the learning and the training is addressing both. And I'm working with 2 organizations, one who looks at ADHD and one who looks at autism and Citywide and the Trinity people. So yes, spot on there. Yeah.
Thank you. Another comment and question. Thank you so much for this session. If I may, I have a question. You emphasize the importance of building strategic relationships with policymakers and converting outputs into policy outcomes. Given that many health policy environments are shaped by commercial lobbying, how can researchers engage policymakers effectively without their evidence being diluted or reframed to align with corporate or market agendas?
Oh, it's a huge problem in the alcohol industry. It absolutely is. Look, all you can do is be known for good research, um, and speaking the truth, if you like, and but always, informed by research. You can't take on the industry, um, but you can control the work that you're doing and do good research and promote the research. But I know in the alcohol industry, as I say, it's huge. The lobbying at an international level is huge.
Hmm.
I'm only Catherine. I can only do, but I have local policymakers, so I
Hmm.
can influence our local minister, our local, TD, our senators as well. Don't forget about the senators, and Trinity has a couple of senators. So, don't forget about our
Hmm.
senators as well. They are a very useful resource as well. And senators are looking sometimes to be TDs. So, they're good people to send a copy of your work to. It's coming from, if it's good research, it will come through, but you can't take on the world, but just do your bit.
Thank you. Um, a person is it's curious to know. It says, is there anyone in Trinity who can help with MOOC development? You might know that or
Yeah,
not, or
Trinity
where to go.
Online.
Trinity
Trinity
Online.
Online. Trinity Online. Yeah, they work with Future Learn. So yeah, they're great. They're great. It's a great team over there.
Okay, so a lot of comments saying you thank you so much, very inspirational. Thank you, Catherine. Say thank you for the reassurance. Sometimes you feel completely out of your comfort zone.
Yeah.
Thanks, great session. So a lot of people very grateful for your
I
talk,
was out of
Catherine.
my own comfort zone this morning, I can tell you. But that's normal. We're only human and we have families and, lunch and, you know, people don't know me personally necessarily. Some of them may, I have 4 children, adult children now. And, so like the work had to be done in the work time, otherwise you get resentful. And I don't want ever to get resentful about my work. So work gets done in the work time. And sometimes when the children were smaller, it might be on a Saturday morning, I might work on a paper on a Saturday morning. I'd be still in the pajamas. But that I always considered my work. Like I would not be correcting exams on a Saturday
Yeah.
morning. I'd be doing that Monday to Friday. But if I was behind or something, or I felt I wanted to get something done, I would be doing it in the pajamas on a Saturday morning, and then spend Saturday afternoon. Similarly, with when the children were young, we took our holidays, we went away, I had the holidays with the children, and that it. Otherwise, you get resentful. You have to be relatable as well, you know. But when I work, I'm working. I'm very focused, and
Okay, thank you, Catherine. Okay, so there are a lot of comments saying thank you so much, Catherine. And thank you from us as well for sharing your expertise and experiences with us today. Thank you to Jenny and Elizabeth for the technical support. And don't forget to join for our next session of Research in Action series with Anya Griffith. And you see Knowledge to Power, Insights from a Career in Public Service. Thanks, everyone. Thank you again, Catherine. That was a great presentation. Thank you, everyone, for coming here today as well.
Thank you, Luciana, and thank you for organizing these and your work. It's great, great idea showcasing the school's work and beyond. Thank you. Thank you, everybody, for spending time with us. Thank you.
Thanks very much.
Bye-bye.